Good day. It's certainly a pleasure to be back with you on the Healthbeat Show. I'm Dr. Jeffrey Watson, and welcome to the Healthbeat Show.
You don't have to take my word, but I heard if you have your health, you have everything. Take my word, but I heard about the Healthbeat you're gonna be. How you wanna be? Show me how you will be. How you wanna be? Show me how you will be. Listen to the show, the more you'll know about your health.
I'm Dr. Jeffrey Watson, and welcome to the Healthbeat Show. Today we're talking about the continuum of care. We're talking about what happens to you as you navigate this healthcare system. We have a whole new healthcare plan coming out. Many of you probably didn't even understand the previous healthcare plan, and we have a series of shows on the continuum of healthcare to try to help you understand what happens to you as you're at home prior to ever getting sick. Disease prevention, that's the key. That's the first thing you want to do. Then when you go to the doctor, what are the issues? You have insurance, you have medications. You might then end up in the hospital. Let's say you go to the emergency room. You have a heart attack. You end up in the hospital, develop congestive heart failure, go to the ICU, and then when you get out, you still require medication adjustment, your diabetes, maybe you're not walking very far. So maybe you go to a skilled nursing facility after that in this continuum. And from there, hopefully you will be well enough to, after a short period of time, to go back home. But still at home, you may now all of a sudden have to take medicine for your heart. You may have to take a water pill. You may have to take a blood pressure pill. You may have to take a pill to keep your heart from skipping. You may need physical therapy. You may need oxygen. You may need someone to help you to get back and forth to the doctor with transportation. You may need a social worker. You may need other types of counseling. And that is where a home health care agency could be of benefit to you. Joining me today is Mr. Harold Goodman, who is the administrator and director of services, is that correct?
Operations.
Of operations at Horizon Home Healthcare Agency. Welcome to the Healthbeat Show, Mr. Goodman. We really appreciate that you would come over here today and help us to understand this step in the continuum of healthcare. Now tell us just briefly, what is the Horizon Home Healthcare Agency? What is that all about?
Well, Horizon Home Healthcare is a Medicaid certified agency that provides skilled nursing for people who've been hospitalized, as you alluded to, have come from a skilled nursing facilities, as well as referrals that's coming straight from the doctor's office.
And they will provide health care within the home.
That's correct.
Some people don't want to stay in a health institution for a long time, or even at all, you know, and but they may have a complicated healthcare situation that requires assistance, and they may require help with their medications. They may require help with physical therapy, with a social worker. Do you all provide all of that type of assistance?
We provide all of those type of services, from the skilled nursing, occupational therapy, physical therapy, medical social workers, and home health aides.
And now, a lot of people are worried that if they were to try to receive any of those kind of services, it's too expensive. I mean, how much would that cost? If I wanted to send all those services to my mom or to my other patients, are they going to have to pay an arm and a leg for that kind of care at home?
Is your mom Medicare eligible?
Yes, she has Medicare.
It wouldn't cost her anything.
It wouldn't cost her anything.
It wouldn't cost
her
her
insurance. So you're saying the health care insurance, the standard insurance that a person over 65 would have, would pay for that?
Correct.
And it would pay for them to give the nurses to deal with the medication, the social worker to help advise them, and it would pay for the physical therapist?
It would pay for everything I mentioned earlier, in which you also stated.
Okay. What about if the person had another kind of insurance, like Medicaid or what they call a health maintenance organization, a HMO type insurance?
Medicaid would not be any out-of-pocket expense for most recipients that receive those services. HMOs usually have co-pays or some type of deductible.
Mm-hmm. And what does it cost for that kind of care at home, even though it's covered? What kind of cost is that to the system about?
Well, I'm not sure if I truly understand your question.
Well, in other words, like some people would say that to stay in the hospital for one day, it may cost $1,500 to $2,000 to either, if you paid out the pocket, or to the insurance company. Does it cost that much to?
Oh, absolutely not. It's about $250, $300 a day.
Oh, so it's much, much less.
Yes. Not to mention, historically, statistics have shown that people actually recover in their environment at home. So you much rather be at home where you can get the proper loving and caring along with the medical care that you're also looking for.
Now, when a person goes home and they receive this kind of care, and again, it could come straight from the doctor's office. The doctor could call or fax you a referral, and you don't have to have been in the hospital. Is that correct? Or in a nursing home?
That's correct.
You know, a lot of patients say to me something like, well, I don't want anybody coming up in my house trying to, deal with me and trying to tell me what to do. When a nurse and the physical therapist and the social worker and all those people come, are they coming independent of a medical request and supervision, or are they coming with the supervision of a physician?
The supervision of the physician. We actually follow the doctor's orders that the doctor or whatever physician has written. So we can't make any determinations. In a lot of cases, let's say for instance, you prescribe a PT, physical therapist, occupational therapist, and a nurse, but once you're in the patient's home, you see that there's some other needs that need to be met. And in a lot of instances, you perhaps wouldn't know that as the doctor because you haven't been to the patient. You only know them from the office environment. And a lot of times we would make recommendations and say this patient would benefit from a medical social worker, or perhaps they need someone to help them with bathing, light cooking, housekeeping, those type of things you may not would necessarily know. Mm-hmm. So a lot of times we would submit supplemental orders for your review and your approval, and we only follow through on those items that you prescribe.
And that's a blessing. When I was a kid, my dad did house calls. He went with his bag over to patients' houses and actually tried to take care of them at home. And back then they didn't really have visiting nurses, so to speak. So you are the eyes and the ears of the physician within the home, so that's truly a blessing. And it's a very significant portion of what we now have as the continuum of care. You try to take care of yourself by yourself at home first, that you keep yourself from getting sick. You may end up in the ER, then in the hospital, then you might go to intensive care. You could end up in a skilled nursing facility, and then you're still not well yet. They move you through the system so quickly. People say, well, I need to just stay in the hospital because I'm not well yet. I've been here 4 days. Well, a lot of times the insurance will say, we're not going to pay the hospital anymore. And they'll send a letter of denial to the patient.
That's true.
And the hospital will say, you know what, your insurance said they're not going to pay us anymore, so we think you have to go. Now, that's not the letter from the doctor. The doctor doesn't say that. So then the patient has to make a decision. Well, many times there's a person within the hospital who helps manage this process. Who would that person be? The case manager.
The case manager.
The case manager.
The case manager.
Yeah, the case managers, they are the kings and the queens of the decision makers as to when you should leave the hospital. They know that a heart attack is only paid for 4.5 days by Medicare. And then on the average, if you stay past 4.5 days, the hospital starts losing money. The case manager goes to the doctor and says, it's time for them to go home. Trazzle, trizzle, trazzle, drone. Time for this one to go home. And the doctor has to fight, well, they're not quite ready yet. I think they still need, well, what about, they could either go to a skilled nursing facility or home. The patient may say, well, you know, I know I'm not well yet. And we might say, well, we know of a good facility that you could go to, or if you really think you want to go home, we can send nurses out there to the house. And so that's how the situation works in the continuum of care now. It can be quite confusing and quite difficult to navigate. We're here with Mr. Harold Goodman. He is the Director of Operations for Horizon Home Health Care Agency, and we're just talking about the whole continuum of care. Something very important that you need to know about, because I always say that if you knew better, you could do better. I'm Dr. Jeffrey Watson. Stay tuned. We'll be right back. Welcome to this segment of Fitness Facts. I'm Dr. Jeffrey Watson. We're right here at 24-Hour Fitness with Miss Shamir Washington and with the tough but great Coach Keith, who's going to talk to us about how to get in shape. Today we're going to be talking with the coach about how to tighten up the abdomen. Later we'll be talking about your sides, and later we'll be talking about your glutes. Coach, tell us some exercises to really get a six-pack going.
Excellent, thank you, Doc. Why don't you guys go ahead and lay back. We're going to go ahead and dive on into some exercises that are perfect for getting you guys ready, swimsuit ready by the summer, toning and shaping the abs. A couple of things I want to point out is when you're doing abdominal exercises, specifically crunches or anything where you're lifting your upper torso, you really want to relax your neck, don't jerk it, and just really breathe. So let's go ahead and first put our hands up. Perfect. Take a deep breath in, exhale and relax. Perfect, and we're going to go ahead and lift up. Ready? And lift. 1, 2, 3, nice and strong. 4, good. 5, that's it. 6, 7, good. 8, 9, one more good one. And 10, good. Hold that position. Take a deep breath in. Good. Exhale and relax. Arms out. Good. And we're going to go ahead and lift up. Okay, what we're focusing on is, again, contracting the upper abdominal area and lifting the shoulders off the ground. And remember to breathe. All right, ready? And lift. 1, good. Lift those arms off the ground. 2, 3, that's better. 4, 5, don't jerk your neck. 6, 7, nice. 8, 9, one more, and 10.
I can feel it. I can feel it.
We're rocking and rolling. That's what I like. We want six-pack abs, right?
That's right.
All right, we're going to do it. Hands down by your side, arms off the ground. Take a deep breath in. Good. Exhale and relax. And lift. 1. Good. Don't jerk that neck. 2. Relax your neck. 3. Focus on your contracting the abs. Take your mind and put it on your abdominal muscles. 6, 7. Good. 8, 9, and last one, 10. Good. And go ahead and relax. Take a deep breath in. Good. Exhale and relax. Last set of these. Hands in between your legs. Good. And we're going to lift. And lift. 1. Good. 2. Nice. 3, 4, 5. Good. 6. Come on. Finish strong. 8, 9, and 10. Very nice, very nice.
There you have it from the coach. Those are the ab exercises. We're going to get that six-pack. You learned it right here on Fitness Facts, coming to you from the 24-Hour Fitness right here in Oakland. We've got Coach Keith, Shamir Washington, and you. Stay tuned for the Healthbeat. And welcome back to the Healthbeat Show. I'm Dr. Jeffrey Watson. We're talking about the continuum of care. What happens to you from being at home if you become acutely ill, end up in the hospital, going from the hospital maybe to a skilled nursing facility, or maybe home, but you're still sick. Or from a skilled nursing facility and you're still not quite 100% yet, you can have a certified home health care agency, such as the one that Mr. Harold Goodman is an administrator for and director of operations at Horizon Home Health Care Agency. Now, again, just reiterate on the services that Horizon Home Health Care Agency would provide to a patient when they're at home.
Well, skilled nursing, physical therapy, occupational therapy, medical social workers, and home health aides.
If what if a person had Alzheimer's disease or dementia, could you provide some kind of assistance in helping them with that?
Absolutely. In a lot of cases, we found this to be true, and we have the medical social worker come in and see what other type of programs that could be implemented to supplement the services that we already offer.
Okay, but basically these services that you're talking about, the nursing, the social worker, the physical therapy, the occupational therapy, now, and this might be in a patient that has congestive heart failure, diabetes, they might have a wound. You do wound care on the patient.
Absolutely.
They might, I even sent a patient home this week that is at home, but he needs an IV.
We do IVs as well.
And so he's getting IV infusion at home. So you assist with that. So they don't even have to be in the hospital. They can get an IV at home.
Yes.
And so these are the types of services. And with registered nurses and people who are certified to do this, and under the direction of a physician. So it's not just like somebody's coming in there. And what if a person's depressed? Do you have any kind of situation where you have a psychiatric social worker or anybody who can deal with their mental situation?
That would be a specialized services, and we would contract that out.
But you could get that
we could
for
get
the
that.
person.
Yeah,
so
dietitians. I mean, we have even though a dietitian is not covered per Medicare, we still provide that service at no additional cost.
Here's something, it's a little bit of a touchy subject, but it's an absolutely important subject in the continuum of care. I have a large number of African American patients, but I have a diversity. I have Hispanic, I have Filipino, I have Caucasian, and they live in different parts of the community. Some of them are poor, some of them are wealthy, and I've had the hospital sometimes send a nursing agency that might be directly associated with the hospital. They don't want to go to that community, and they don't want to deal with that person and their racial makeup or place of origin and the language and the multi-ethnic situation and the diverse situation. How do you handle that? Does Horizon deal with these social, economic, political issues that deal with diversity?
Absolutely. We like to say that we're here to serve the underserved community. Approximately 70% of our patients are in the Oakland, Berkeley, Richmond area. We have a very diverse clinician staff. We have clinicians that speak several languages, so Spanish from the Filipino community, and occasionally we got a couple of clinicians that even speak Russian. So if we're here to serve the community, and that's one of the reasons we got in this business, because we determined that the African American community is underserved. So we don't care where you come from, we'll service you.
And because a lot of times, again, the patients will say to me, I don't want somebody coming in my house. They're a little bit nervous. They don't think that they'll understand their environment and where they're coming from. But you're saying you actually make it a point to deal with issues of diversity, ethnicity, their socioeconomics, the community that they live in. And you will go into these places that sometimes I've had other agencies, I didn't hear from them for a while, and then the patient comes back in the hospital and they're sick, and I say, well, did the nurse come out? No, they didn't come out, And then I might get a note that they, rang the bell, didn't answer, so discontinue, But you all try to make it a point to really address those kinds of issues.
Absolutely.
Now, what about, let's say a person isn't sure if their insurance will pay for this or not. Does the social worker really take the time to go through to work with them to make sure their insurance will pay for it?
In a lot of cases, a lot of the people are just so ill-informed, and I'm so glad that we're having an opportunity to have this discussion, because I can't tell you how many countless hours I spend on the phone talking to potential patients and clients and explaining to them how this whole process works. And in a lot of cases, the medical social worker becomes the advocate and assists the patient in ensuring that they get the proper insurance coverages and actually helping them as it relates to having discussions with the insurance companies.
Now, let's say that the patient is coming out of the hospital and the hospital tells the patient, I'm going to send this one group to see you, but maybe they saw you on TV, or their cousin told them about Horizon Home Healthcare Agency, and the patient has in their mind, I'd like Horizon to come see me. Do they have to go with who the case manager at the hospital says, or do they have a choice about it?
Absolutely. Absolutely, they have the choice to make under patients' rights. They have the right to decide which specific agency they would like to go to.
And so the patient can say, well, I'd really like to go to Horizon. The doctor, if they tell the doctor that, and then the doctor asks for it, then the hospital and the case managers are supposed to help facilitate that.
That's correct. If the doctor prescribes Horizon, which I hope you will prescribe Horizon, and the patient say they want Horizon, then they have to give the patient that choice.
What's the usual process for a patient to get home health care? That's going to be my next question. We're going to take a short break, and when we come back, I'm going to want you to tell me, how does that process work? Does the doctor send a referral? Does the hospital tell you? Do you call them? Does the patient call you themselves? How does it work? Stay tuned. We're talking about the continuum of health care right here on the Healthbeat Show. I always say that if you knew better, you could do better. I'm Dr. Jeffrey Watson. We'll be right back.
Have a good night and rest easy.
Are you tired, sleepy, depressed, snore a lot, sleep a lot during the daytime? Do you have high blood pressure, diabetes, or suffer from sexual dysfunction? You may be suffering from sleep apnea. Talk to your doctor and contact the James A. Watson Wellness Center Sleep Clinic. Remember, we want you to have a good night and rest easy. Give us a call today at 510-444-8627. Remember, that's 510-444-8627, and you'll rest easy.
I'm Dr. Jeffrey Watson. Welcome back to the Healthbeat Show. We're doing a series on the continuum of care. What happens to you in the healthcare system? We got a new system. If you come from first being at home, being healthy, then go to your doctor's office, you end up in the hospital because you had a heart attack. From the hospital, maybe you go to a skilled nursing facility. From there, you go home, but you're still sick. So you have a certified home care agency with registered nurses, physical therapists, social workers. You can get an IV at home, you get your medications adjusted, all those kinds of things with a certified nursing agency such as Horizon Home Care. We are Home Health Care.
Correct.
We are here with Mr. Harold Goodman, who is an administrator and director of operations. How does the process work for a patient to be referred or receive the services of a certified home health care agency like Horizon Home Health Care Agency?
Well, the doctor has to submit doctor's orders. So he would prescribe the services for home health care for the particular patient. So once those orders are written, they're faxed over to our office, and we would then contact the patient. Since most of the referrals are those that are with the hospitals or coming from skilled nursing facilities, once they're home, we're there in their home within 48 hours providing them the continuance of care.
So the doctor would send that over, and if a person wanted to call and just inquire about it, what number would they call for Horizon Home Health Care Agency?
they would call 925-258-9101.
Now, this we said was paid for by major insurance, Medicare, Medi-Cal, HMO, these types of things. Now, 60 days is how long they can get the care?
That's correct.
Let's say after 60 days they said, "Ooh, you were so good, and that really helped Mama so much." But the insurance, you know, we still need some help. The patient and the family say, we still need some help. Is there a way that there's some ongoing service or a service of another type that they could get?
Absolutely. Not only does Horizon have a home health care, which is a Medicaid certified agency, we also have Horizon Private Duties. We don't provide the skilled care for PT, OT, MSW, etc., from the private duty side, but from caregivers and for the
Well, what would they do? They would cook for them. They would clean for them. They'd go to help them come to the doctor's office. They'd make sure that they took their medicine right, put it in a pill box. Is that the kind of thing that they would do?
Well, the caregivers could not do the pill box, but a certified nursing assistants. Forgot for a second what they were actually called, but the CNAs are caregivers who we sent out. So yes, they would assist them for cooking, cleaning, companionship, and just kind of taking the load off the family, because you know, once the Medicare certification is over, care is over, a lot of times the families need someone to just assist them. And even from respite care, we provide that. If you're dealing with it day in, day out, 24/7, we can have someone to come in for a weekend, a week, or whatever, and provide that assistance up to 24 hours a day.
So we're talking about the continuum of care: home, going into the ER, the hospital, a nursing home, certified nursing, and then private duty nursing to take care of them after that.
Yes.
Okay, I hope that you've learned something. I've learned something today as we've talked about the continuum of care. We've been here today with Mr. Harold Goodman from the Horizon Home Health Care Agency that also has another part of their business which is involved with private duty nursing as well. We've learned today. We've talked previously with some of the skilled nursing facilities, and we'll talk more about the changing healthcare system. This series that you have been seeing is on the continuum of care. I hope that you've learned something. I always say that if you knew better, you could do better. I'm Dr. Jeffrey Watson. Remember always that your health is your wealth, and when you have your health, you have everything. We'll see you next time. God bless.
You don't have to tell me what I wanna be. You don't have to show